家中宝宝高烧不退，身上起红疹、双眼发红等症状，这些都是川崎病的病症之一。到底什么又是川崎病呢？我们一起去请教医生吧。
So hi everyone. So my name is Dr. Marhisham bin Chemud. I'm a consultant pediatric cardiologist in Institut Jantung Negara. I have been in IJN for the past 12 years. The signs and symptoms of Kawasaki disease is basically based on the criteria of the diagnosis, especially fever, 5 days of high-grade fever, papular rashes, and some conjunctival injection, or the eye become red, strawberry tongue, and also some edema or swelling of the fingers. So this is part of the diagnosis or clinical signs and symptoms that we made the diagnosis. Kawasaki disease is basically acute febrile illness, which is characterized by some of the criteria to diagnose Kawasaki disease. There is no specific etiology or causes of Kawasaki disease. But however, some patients might have some genetic predisposition. But again, this is not something that proven to be cause of the Kawasaki disease. And even though infections was presumed to be one of the cause, but again, this is not something proven that infections can cause a Kawasaki disease. So Kawasaki disease, generally, the incidence is about 150 cases per 100,000 children under 5 in Japan, and in the United States it's about 10 to 15 in every 100,000. And in Malaysia, we do not have updated Kawasaki registry to know the exact number of the incidents in Malaysia. But however, based on the calculations, according to the incidents, so it's about 700 cases per year. So because in Malaysia, we have roughly around 500,000 live births every single year. So in average, I think probably it's about 700 cases per year in Malaysia. There's no basically specific assay that we can use to diagnose Kawasaki disease. So basically the diagnosis based on the clinical symptoms and signs that observed in a child with Kawasaki disease. The symptom that I've mentioned previously, the fever, conjunctival injection, rashes, and we can actually also perform some other investigation, example like blood tests to see increase of the platelet numbers. We can also do echocardiogram, basically scan the heart to see any coronary artery dilatation. So this is suggestive of Kawasaki disease. The treatment for Kawasaki disease is basically based on the timeline, the acute management, which is including IV immunoglobulin, sometimes require steroids, and also aspirin. But for the long-term treatment, which is include the medications and also specific investigation. Example, those with complicated coronary disease, so they require a lot of screenings. Alright, the echocardiography, some of them require special scan, example the perfusion scan, CT scan of coronary arteries, and also angiogram, coronary angiogram. So the treatment based on these findings from stress tests or CT coronary arteries. And the treatment may include anticoagulant, so meaning that the patient may need to take long-term anticoagulant or blood thinning medications. Some of these patients may require intervention of the coronary artery, if not by percutaneous coronary intervention, or sometimes patients may require coronary artery bypass surgery in complicated cases. So my advice is basically to two groups of parents. One, for parents who has children with symptoms of acute Kawasaki. So please get early treatment and seek the treatment as soon as possible, because early treatment may basically prevent severe illnesses in the long term. And the second group is those parents who has children with already established Kawasaki disease and has coronary complications. So please comply to the follow-up and also the treatment, because the complication of this narrowing of coronary is very serious, and in fact patients has a poor or impact of ventricular function, and also may also cause a sudden death in the severe disease.
记得关注东方日报，并按赞、留言以及分享这支影片给你所有的朋友们。我们下期的节目将会以直播的方式进行。 如果你有什么提问的话，都能直接在直播上询问医生的解答哦。这期的节目就到这里啦，我们直播见。